All right, now let's talk about reducing maternal mortality. And while there's the need for a strong maternal health response from the public side, where we keep stretching governments, the focus of the public health sector, it is increasingly becoming clear that the public sector is not capable of providing universal access to quality maternal care on its own. And that's why our next conversation is absolutely important. In Ghana, as in most African countries, the private sector, has been helping. They've actually been a very supportive player and a crucial one at that in securing access to essential health services as a major supplier of all forms of care, including maternal care. Now, are we ready for a new challenge in Ghana with regards the reduction of maternal mortality rate? My guest, Dr. Paddy Ayete, a specialist obstetrician, a gynecologist at Resolve Medical Services. Good morning. Thank you for coming, Sam. And also Dr. Maxwell Entry, who is also a specialist obstetrician gynecologist, Farmer Access Group, and they're testing me this morning. Good morning to you.
Good morning.
Yeah. How important is this whole conversation about reducing maternal mortality? I'll start with you.
So we live in a country where we lose 350 of our sisters and mothers who tried to bring 100,000 of us to life. And that's a very pathetic picture. I mean, if you compare it with the gas explosion and how many lives were lost, and another national tragedies and how many lives were lost, you realize that this figure dwarfs all of them. So it then behoves on us to look for innovative ways that we can bring high quality maternal care and make it affordable and make it convenient so that we can help address one of the major challenges we have in Ghana with our healthcare, which is maternal mortality.
Dr. Ayete, is it, we keep saying that the public sector cannot contain it alone. Is it really true?
Well, certainly it is true. It is common to find that you have an overwhelming number of patients trying to access a limited number of spaces in the public sector institutions. And that is why patients sometimes have to deliver on the floor. Sometimes patients would labor, and there's a long queue to have a cesarean section. And the result is that the uterus would burst whilst waiting. And you've got people who are losing their lives because there are just too many people for the staff available to be able to cope with. Usually, typically in labor, you should have one nurse to one patient, or a maximum of one nurse to two patients. But in our public sectors, you have one nurse to about 6, 7, 8, especially when they're in labor. And all kinds of problems go on. We've got mothers losing their lives, but even in greater numbers, mothers losing their babies. And it's about time these things stopped. And the pity is that you have a lot of these people crowding the public sectors, and yet there are maternity homes, even now, that are empty or near empty.
Why is that? Is it not perhaps also because of the cost involved? Or is it just a perception?
It is not only a cost issue. Because there are some, the traditional maternity homes don't charge very much, actually. And even some those who are on the national health insurance, they pay them not very much money. But there is the perception, especially even today, people will tell you that, oh, for good care, you need to go to the public institution, because if you have an emergency, that's where they'll send you to. The problem with that perception is that if all the normal people are going to the public institutions, then they get crowded, and then the sick people who really need that care don't get it, and all die. Doesn't help.
I've seen people go to queue, pregnant women, like the whole day, just to see a doctor, and it's not an emergency; it's a regular meeting with the doctor.
Exactly. And just to break this down, we all know McDonald's. So McDonald's is a franchise. What we have sought to do is to franchise healthcare, to bring high quality maternal healthcare, break it down, and bring it to the doorstep of pregnant women. Provide them at locations where they can have quick access to. So you would have the same taste of a donut in McDonald's in Accra as you would have it in Las Vegas. So that is what we have sought to do. There are good examples of practice for maternal care that are doing well in Ghana. The question is, how do we make sure that these are available to as many women in Ghana as possible? So that's what we have tried to do.
Okay.
So it's a franchise system.
So that's the innovation,
Exactly.
that you're bringing. But
Exactly.
before that, because this sounds, almost like something that I probably have heard before somewhere. So I want to ask Dr. Aite, the CHIPS compound, how has it helped? How has it not helped? I mean, is there anything, before you speak, are there things that you've learned from this CHIPS compound that you're incorporating, in this? I want to hear from you on this CHIPS thing.
Okay, the CHIPS compound idea was to be able to provide care in the community, and it was designed by it's part of the public system. The challenge with that has been, first of all, it has to be funded by government. And you know what happens when it comes to funding by government.
So we've gone back to the same public sector thing again.
So the public sector challenges affect the running of the CHIPS compound. The other problem is systematized, standardized care across board, strictly supervised, with direct, immediate access to higher levels of care as need be, and strict supervision is what the project we are on is trying to do, to ensure that everybody gets the same level of care everywhere they go, at a high standard and at a high quality.
Is that possible?
It is possible.
Has it been practiced somewhere?
So yes, so there are best examples outside of the healthcare space. So you have franchise is not a new concept in the world.
We've
Franchise
got
is we have KFC, you have franchise in the food industry, we have franchises in the hotel industry. We are yet to have franchise in the not so much the pharmaceutical. We tend to run branches in the pharmaceutical. So for the healthcare sector, a franchise is quite a new concept. What we have tried to do is to borrow the principles of good franchising and apply it for a social good. And we have taken our time. We have worked on this for 2 years.
Okay.
We have taken our time to work out the whole operational model. And every I is dotted and every T is crossed in terms of human resource, equipment, location, supervision, contracting, referral levels.
In Ghana, we're quite critical.
Exactly. So we have worked all that in a manual. And we have trained the staff from the clinic level to the bigger hospital level. And we have connected who should be responsible for what. We have brought in technology that enhances the ability of the specialists to be able to real-time monitor what is happening in the clinic at the midwife's desk.
Are you talking about Ghana right now?
Yes.
Yes.
Because
yes.
as you're talking,
Yes.
I'm just
It
picturing
looks
them.
so. Yeah. So let me just give you an example. If a midwife sees a pregnant woman, immediately we get 3 codes. One is green, one is amber, one is red. The green means that the pregnant woman is safe to go home.
Okay.
Amber means that the specialist should be called and the case discussed with the specialist. Red means that the ambulance engine must come on to transfer the client immediately to the specialist.
Okay.
And we have worked all this out in terms of waiting time, response time, and who receives the client, transmission of data. So all that has been worked out.
Can we
go
go back to the beginning?
Yeah.
So you're talking about customized. Is it customized? Am I right?
Yes, you're using the right.
Okay.
Customer-centered.
Care.
Yeah.
So if I get pregnant today, and I have to begin to see my gynae periodically, I can see one at my convenience. Is that it?
Exactly. So, and Dr. Aite mentioned it. It's not about 75% of all pregnancies don't need any human intervention.
75.
Yes.
Throughout.
Yes. Oh. That's why animals deliver without any intervention. That's why people in other places where there's no supervision also can deliver without intervention. The challenge is how to identify about 15 to 20% who really need intervention. Now, if you bunch all of them together, the risk is that the ability to identify who is called high risk is then diluted. So Dr. Aite gave those examples. If you bunch all the 100 together, you miss the 15. And that's why we have the high maternal mortality rate.
Okay.
So what we have done is to separate the low risk, and I gave you the green, the amber, and the red.
Okay.
The low-risk ones who don't need any attention are seen by midwives.
So, Dr. Ite, how do I know? Can I know as an individual whether I am amber or I'm red?
The system actually defines who you are. Okay. But as an individual, if you know that you've had 2 previous babies and you've had 2 previous cesarean sections, or you've had...
Sounds like you're talking about me.
or you've lost previous pregnancies, you would know that you would require a certain level of care more than the person who has had 2 or 3 normal vaginal deliveries without any complications. That's just an example for you, the individual.
Okay.
But the idea basically is that you can report at any of these stations. You'll be seen by a midwife. The midwife would see you and assess you, enter your parameters into the software. Automatically, we know where you'll be placed.
Okay.
Now, the way the system operates is that once you've entered the information they've gotten from you into the software, if I need to be informed, I'll be prompted, even before I'm called. That
immediately on his phone.
Yes, this person has this problem, and expect a call from this person. If I don't get a call in a few minutes, I am going to be calling you to say what's the matter with this client and what can we do about it to fix it.
So where would the points be? Okay. Because if you're talking about convenience, then I want to be able to also, whilst I am at work, be able to use my lunch time and say I'm going to see the gynae instead of calling sick and take the whole day off.
Exactly. So we are starting with 4 outlets now. We call them hub and spokes, so they are big words. But the hubs are the bigger hospitals. The spokes are the smaller clinics that are run by midwives that are located in places where people are much more populated. So we've cited one at Adenta.
Okay.
So we have one at Adenta, Snake Flats. You know how well that area is populated. And we have one in Tema.
Okay.
That we're starting with. So we are starting with these 2. The good thing is that you don't need to be a doctor to own one of these.
Oh, you don't?
You don't. So what we have done is to, in the same way that you don't need to be a petrochemical engineer to own a fuel station, you don't need to be a doctor or a midwife to own any of these. They will be run by midwives, but they can be owned by you.
Okay.
And what we have done is to define how much you need to invest. So we have the business case, what we call the business case. If you put in a amount of money, how long will it take you to be able to reach break-even point? We have put in architectural drawings that are required, human resource requirement. We have defined training. We have defined how referrals will be structured. And we have actually gone on to even define, if you're looking for investment, how to be able to bring in more investment. So we have worked out the operational model. All I'm describing is called operational model. How does this work? And how much do you need to put in? And how do you expect to get returns out of this, both social benefits and also economic benefits?
So, Dr. Ite, your place at Adenta, if I went in today, is it open?
The launch is tomorrow.
Okay, but what would I find?
You find a very beautiful room. Really looks nice. Really looks nice, with colors that you would like. Okay. You'd find a nice person at the reception who would meet you. Inquire as to what you are coming to do, take your information, you'll be registered onto the system, and then you would be ushered in to see the midwife on duty. The midwife on duty would provide the care that you need, do your necessary labs that need to be done, provide you with education, and then provide you with treatment. And then discuss a follow-up with you and schedule what your subsequent visits would be.
Okay.
Now that midwife now knows you. If you miss your appointment, she's coming after you. She's going to find you. What is the problem? Why didn't you come? That same midwife is the one that if at 2 a.m. you have a problem, you call her and say, this is my problem. And then she facilitates everything for you, even though she's not on duty.
Oh.
Yes, she's your personal concierge through the entire delivery process.
Wow.
Yeah.
Okay. When I opened that, I also saw a hub, which is a bigger hospital.
Exactly.
Okay, so what would the hub do in the
Okay,
sense?
so the smaller clinics called spokes will run all the antenatal. It's a spoke.
Okay.
Will run all the antenatal services that you require during the pregnancy. The hubs will be responsible for complications, if there are any complications, and then for delivery services, and then post-delivery services. So what we have tried to do is to connect the hubs and the spokes in a seamless manner in terms of data transmission, in terms of patient referrals, and also in terms of supervision. So what you get at Adenta spoke or Tema spoke is almost as what you will get when Dr. Este is taking care of you, or when Dr. Inin at Airport Women's Hospital is taking care of you.
Okay.
Because even though you are being seen by the midwife, you are being monitored real time by the supervisor.
So your information is actually out there for all the other specialists
to see.
Okay.
So when there's a red, all of us get an alert.
Oh, that's nice.
Yeah.
But you're not in the entire country.
No, so we are starting with these 4, so 2 spokes, 2 hubs. We are driving to get more investments into this, so we're encouraging a lot of.
So this is almost like a two-way thing.
Exactly.
Now, whilst you promote this, it's also like a business, an area for people to also invest in.
Exactly. Let me give you an example. So I went to the Ministry of Health last week to invite the minister to attend the program, which we're looking forward to him tomorrow. And right at the car park, I saw midwives in red banners at the car park demonstrating to have their appointment letters. Now, this creates an opportunity to get midwives. We have 245 doctors at home now waiting for appointment letters.
Yeah.
This is a great opportunity to expand our private sector space, to be able to create jobs, but also deliver the same social good that help us meet our SDG 3 goals.
So let's talk business. How much money do you need to own a spoke?
You need
less than a fuel station.
No, it's far less than a fuel station. All put together, you would be. So we have 2 models. We have rental, where you rent a space, and use it to run, and then we have a build, where you build, and then you own the infrastructure yourself. So there are 2 cost models involved. What we are trying to do is to work out both. We are going to use, and your office space is also not equally priced in Ghana. So you can imagine the office space in my village might be cheaper than the office space in Accra. So if you take out the infrastructure bit, this is very cheap to run.
Okay.
Yeah.
So you know the way it's good we are using the fuel station as an example. The way the fuel stations run, I think you need to own the land. You just identify the space, and then they will build the thing. What do you do? Do you put the equipment in there, or it's all part of the person who is investing?
So we've defined all the equipment costs. We've defined, you have the architectural drawings that should be put in place. We have architects who are working with us if you need a construction done. Okay. We have worked out the supply chain that goes with it.
All right.
So you yourself, if you want to own any company now, in addition to what you do at multimedia, you might have to find some time to always be there to make sure it works.
Yeah.
This you don't need to.
You do. This is Ghana.
Yes, but we have a franchisor who monitors the system
in real time.
In real time on your behalf.
Now, so I say, has this worked anywhere else?
The franchise system, yes. We've had even in health franchises. There's an example, for instance, in Rwanda. We've gotten one of the top franchise experts in the world on this project, and he's really excited about it. He's arriving actually for our launch. He's really, really excited about it. And when we had the initial discussion with him, was talking about they've done the model in East Africa to try and that was more of a social franchise.
Okay.
And so they are putting a lot of money in, but for the design for it to be profitable is something that he finds very appealing and very innovative, and that is why he's very excited. He spent so much of his own personal time and money just on this project to be able to get it to work. In Holland, for instance, there are individual clinics that are run by individuals operating on a system and they are all connected to large hospitals. So most people just go and see the midwife in a small office in Holland, and then you go and deliver in a big hospital, or you deliver in your home by that midwife. And it's a really nice, innovative system. We've examined that system as well. So yes, it has been done in various versions. We've tried to take the best out of everything and put it all together for what we are trying to do here.
These days, when we talk about things in Ghana, we say homegrown. So this is our own homegrown initiative.
Exactly.
Okay.
This
so
was
what's the
conceived
plan?
by Ghanaians, designed by Ghanaians, and being implemented by Ghanaians.
Yeah. Okay. So now we have the Adenta and the Tema one running. That's the initial one that you're starting with.
And linked to the two hubs. One at airport, so Airport Women's Hospital at Airport Residential Area is a hub, and then Resolve Medical Services at Tema is also a hub.
Are you giving yourself some time to test, to see how this really works, or you're just hitting the ground running?
We're doing both. So we of course, once you get a lot of traffic and throughput, you'll be able to refine the business case. As for the investment costs, you already know it. You're looking at when do you get to break even? Yeah. So for those who are interested in investing in the franchise, we'll be able to give you more numbers as to, of course, we've done the business planning around it, but sometimes the numbers might be a bit different from what you find on the ground. So that's what we use the time from now to the next.
Okay. Is there a fixed rate if I'm going to Adenta? If I'm pregnant right now and I didn't start with your spook, can you start at any time?
Yeah, you can start.
But in terms of costs,
what we have done is to break the cost a bit down.
Okay.
At the level of the spoke. So actually, if you turn up at the hub without going through the spoke, you pay a little bit more.
Okay.
Because the cost now at the hub is what you pay. What we have done is to bring it down, so that if you start at the level of the spoke, your cost is actually lower.
wish I could try this, but I'm not pregnant.
Yeah.
Oh, but you can come for a visit.
Yes, so,
please do.
Yeah,
but
so
I don't know.
Have a look at it yourself.
Can we put somebody on this and see how it works?
Send a mystery client. We ourselves have sent a mystery client because we are the franchisor.
One of my producers.
She's pregnant. Good. It's on. When are you coming?
So Farm Access is the franchisor. We are supposed to make sure that the brand works.
Okay.
And Resolve, so we have a company called Women's Resolve Network, which we are licensing to run the franchise in Ghana.
Okay.
So we have to make sure that the franchise works. So we have sent actually 2 mystery clients already.
Yeah?
To go and test the system and bring us good feedback.
Just finally, we've got to wrap up. So can you give a phone number so that people can get in touch and, more information on your websites?
Good. So our website is woman360.net. So it's www.woman360.net.
Okay.
For a phone number, if you call 0555 000 275.
0.
Okay.
Yeah. So 555 000 275.
Okay.
We'll be able to connect you.
Okay. All right. So this is customized maternal, where I just I'm at work and I just call my midwife and say that I am coming.
Yeah.
Just like about 30 minutes and then I come back to the office.
Exactly.
Ha.
Yeah.
I wish I could try.
Please do.
Thank you very much, doctors, for talking to us about this. And I love the fact that we can also use this medium to also employ. There are a lot of people agitated in the system.
Yeah.
People are not getting jobs. So thank you very much for your time this morning.
Welcome.
Thanks for sharing. Dr. Paddy Aite is specialist obstetrician gynecologist with Resolve Medical Services, and Dr. Maxwell Nchi, he's also specialist obstetrician gynecologist with Farm Access Group.